treating Marchischuk, doing an IM injection. So it's February 7th, 2021 at 16:35. So we'll compare the physician's orders to the MAR. So we have Jake Nursing, Finn 312, Finn 312, 654, 654, 987, 987, date of birth January 1st, date of birth January 1st, 1960, 1960. And the doctor is Dr. Skills Lab, They have no known allergies, but I'll ask them at the bedside. Just checking if there's 2 transcribers and reviewers on each order, which there are, and the doctor has signed the physician's order sheet, so that's good. So then scheduled medications we have are ondansetron 6 milligrams, IM daily before supper. It's given at 1700 hours and it's 16:35 right now, so we're within the half-hour time window and it hasn't been given yet, so we will be giving it. And then we have heparin 5,000 units, subcut, daily at 8 o'clock, and it is 16:35 right now, so we will not be giving it, and it has already been given. So also I just want to note that the patient has been admitted for uncontrolled nausea and emesis secondary to chemotherapy. Okay, so now that we've compared that, I will wash my hands, and then I will get the medications. We have ondansetron. It's given IM, and this doesn't say, so we'll check the drug monograph. So we have ondansetron. It's given IM, administered undiluted, supplied in a 2 milligram per milliliter single-use and multi-dose vial. So this is a 2 milligram per milliliter vial, and it is a single use, so that is good. Also, the maximum single dose is 60 milligrams for patient less than 75, so our 6 milligram dose is safe to give, and it be given by a student nurse. So now that we know it's safe to give, I'm going to check for expiry date, not expired. The dose that I'm going to be giving is 6 milligrams, so because the vial is 2 milligrams per milliliter, I will be drawing up 3 milliliters of ondansetron. So I'll just look at my drug card. So we have ondansetron, it's an antiemetic. It's used for nausea and vomiting due to chemotherapy and radiation. So now we know what it's for, so I'm just going to wash my hands. Then I'm going to get my supplies. So I have a 3 cc syringe. In clinical practice, I would be using a larger one, say a 5 cc, but for this demonstration, I'll just be using that. I have the blunt fill, and then the IM needle I'm going to be using is a 23 gauge 1-inch needle. Okay, so now I'm going to prepare my, throw that in the garbage syringe here. Throw that in the garbage, and since this is a single dose vial, I will open it and then I will clean it with an alcohol swab for 30 seconds in a circular motion. So that was 30 seconds, throw that in the garbage. While that is drying, I'm going to draw up 3 milliliters of air. So now the vial is dry, so I'm going to inject the 3 milliliters of air into the vial, and then I'm going to start drawing up my medication. Okay, I'm just gonna knock out. Okay, so I knocked out the bubbles, and then I'm just going to withdraw a little extra just to waste after I've put on the IM needle. So I'm just going to use the scoop method, scoop it. Then I'm going to pull back to make sure that all the medication is in the syringe. And I'm going to prepare my IM needle. So I'm going to throw the blunt fill in the sharps container, and then I'll attach my IM needle, throw that in the garbage. And then I will calibrate to the correct dose, making sure there's no bubbles, and I'm just watching for a bleb at the top, which there is one. So now I'm going to take the cap off and waste the rest in the med waste bin. Just going to recap it. Going to make sure I have no bubbles here and making sure that I have 3 milliliters. Okay. And while you're checking that, I am just going to make a label. So I have Jake Nursing ondansetron. IM, 6 milligrams. The volume is 3 milliliters because the concentration on the vial is 2 milligrams per milliliter. It is February 7th, 2021 at 16:35, and my initials is CMUMSN2. Okay, so now I'll do my second check. So we have Jake Nursing, ondansetron, 6 milligrams. This says it is 2 milligrams per milliliter. So we would have 3 milliliters. So it says 6 milligrams. There is 2 milligrams per milliliter. So we have 3 milliliters in the syringe. And so we have 3 milliliters. It is given IM. This doesn't say IM, but we checked the drug monograph and it said it was safe to give IM. It's an IM needle. It's given daily before supper at 1700 hours. It is 16:35 right now, so we're within the half-hour time window, and no one has given it, so we will give it. So this is a single-use vial, so I'll be throwing it in the med waste container. Then I will get ready to go to the bedside here. So I have my black pen, alcohol swab, cotton puff, gloves, label, and the needle. I'll also take my drug card and the MAR. So then I will go to the bedside. So I'll enter the room, knock, knock. Hello, my name is Marchischuk. I'm going to be your student nurse today. I'm here to give you your intramuscular ondansetron injection. So as I enter it, I'm doing an entrance safety check, making sure the patient's not in any distress, call bells near them. The bed is down and the railings are up. So then the first thing I'm going to do is check the MAR to the wristband. So here we have Jake Nursing, date of birth is January 1st, 1960, date of birth January 1st, 1960, and no known allergies, and it says no known allergies. So then I'll ask them, can I have your name? They say Jake Nursing, date of birth January 1st, 1960, perfect. And do you have any allergies? No. Okay, so now that we have identified that we have the right patient, I'm going to be doing my third and final check. So here we have Jake Nursing, ondansetron, 6 milligrams. So the vial had 2 milligrams per ml. So we have 3 ml, and then we have 3 ml in here. It's given IM, it's IM needle. It's given daily before supper at 1700 hours. It is 16:35 right now. So we're within that half-hour time window. It hasn't been given, so we will give it. So now that we've done that, I will just tell the patient that I'm going to be giving them an injection. The needle is going to be going into their muscle, and it is for their nausea and vomiting. So I will be telling them that the drug I'm giving is ondansetron. It's an antiemetic for their nausea and vomiting due to chemotherapy and radiation. Some side effects that you might experience are dizziness, diarrhea, constipation, and if you are experiencing an allergic reaction, you could get a rash or changes in respirations. So I will just tell the patient that they should report to me if they do experience any of these side effects like diarrhea, constipation, rash, and changes in respirations immediately. Also that they should be cautious while moving around because they might be dizzy. So if they need to get up, please call me. So before I give this medication, I have already assessed for their nausea and vomiting, which they are experiencing, and any hypersensitivity, as well as their hepatic function and QT interval prolongation on the ECG. So now that I have done that, I'm going to landmark the site, and the site I'm using is the vastus lateralis. So I'll put one hand on the greater trochanter, the other on the superior aspect of the knee, and then I'll close my hands, and right in this middle area here on the lateral anterior aspect of the thighs where I'll be giving it. So now that I have done that, I will wash my hands and put on my gloves. I'm just going to clean the site in a circular motion for 30 seconds. And I'll let that dry. And at my facility, they don't want us to aspirate, but if they did, I would inject the needle at a 90-degree angle, and then I would pull back on the plunger. And if there was blood, it's an indication that I'm in the wrong place, so I would have to restart. But like I said, I do not have to do that. So I will take the cap off. I will Z-track, so I'll be pulling the skin across like this. I'll be darting it at a 90-degree angle, stabilizing, and then not aspirating. And I will be slowly administering the medication. Okay, I'll remove the needle. I'll let go of the Z-track and put a cotton puff here for 30 seconds. I'll tell them to hold it. I will activate the safety mechanism and throw it in the sharps container, but for now I'll just place it over here for the demonstration. So 30 seconds is up, and I'll take that, throw it in the garbage. I'll take my gloves off. I will wash my hands. I will sign the MAR. So here we have CMUMSN2. Okay, so now I will tell them that the desired outcome that I am looking for is decreased incidence and severity of nausea and vomiting. I'll be monitoring for the side effects that I stated, such as diarrhea, constipation, rash, and respiratory distress, as well as monitoring the injection site for any irritation. And also just monitoring for their nausea and vomiting to come back. So now that I'm done that, I will gather up all my supplies, clean up. I will do my exit safety check, so I will make sure the bed is down, they're not in distress, side rails are up, and the call bell is near them. And then I will leave the room, and I will write an IPN and document that I assess for their nausea and vomiting before giving the ondansetron, and just that I will continue to monitor for any side effects.